Thank you very much, Mr. Chairman, and thank you for Secretary, Director. Thank you for being here, and thank you to everyone who's in the room and interested in doing this responsibility we have and doing it as best we can, and as fair and balanced as we can. Allusion was made earlier to the welfare code for the current budget year, and some of the sometimes classified as a little unusual charges that we gave both you and us as a legislator. They are monumental in some ways. In a limited fiscal arena, which is established by state revenues, we've not only asked you to limit spending, but cut costs, and I think that's a pretty monumental task, which thus far you've met, and it had not to been easy. But I have a few questions with regard to Act 22. We charged you with making some common sense provisions in this year's budget. We were looking at, one was regard to income eligibility. Common sense system in place just had to be used. Another provision was a county of residence for cash benefits, putting that in place, a pilot drug testing program for applicants and recipients with drug-related felonies, and then some changes also to the special allowance programs. That was my understanding of some of the provisions that were made in addition to the authority for some of the expedited regulations, which we were just talking about. How are we doing with those provisions? I don't know if it's going to be an easy answer. And then specifically talk to us about the drug testing. I know you were using a pilot program structure, at least in one county, looking to expand it to 2, and then talk to me about statewide. We get an awful lot of questions about that particular provision.
I do know that the drug testing provision receives a lot of interest. So I'll start with that. As you know, it has been implemented in Schuylkill County, and preliminary data, and we really don't have a lot of data because it's just begun, is that it's moving very positively. From a financial perspective, it will take time to save money simply because, as you know, our law, as opposed to other states who have tried to do this, our law basically gives people a second and third chance, which I think is a good thing. So I think from the perspective of how it's going, what we've heard, it's going very well. It will begin in Lehigh, the Lehigh area also. So we are moving forward in a systematic way to do this, to move it statewide, but we're doing it in a very methodical way to make sure it's done correctly and that it's not rushed. So from that perspective, that is, I think, has been a success. In regards to the other areas where we can certainly implement, we're implementing. So you asked about the special allowances. We've been moving through all of our special allowances, looking at our SNAP program, our education, our transportation, what we allow, and trying to enforce good cause for somebody, going to work and employment. We've been going through all of those, trying to implement those in a very methodical way, as I said. And the regulations, the current regulations that are out for comment, reflect those. And so I think when it's all said and done, from the perspective of those provisions, we will have implemented most, if not all of those, and we can provide you with a list, sort of like a checklist, so we can show you a timeline as to where everything is. But we have been working very diligently on that.
The list is great, and savings as well,
certainly.
As best you can calculate those for us. And are you working with, and I'm sorry that Chairman DiGirolamo had to leave. I don't have any trouble with that name. Do you notice that? I practiced before I came out, Mr. Chairman.
I just call him Gene.
Yeah, that's better. Yeah, I think he likes that too. Are you now coordinating, or are you establishing a coordination with your findings on the drug screening with the new drug and alcohol programs and whatever we have in place there, so that we are working together on that?
Are you talking about the new department?
Right.
As you know, the new secretary has just started, and I think he's just trying to organize his operation. We are trying to work with him, but I think it's a work in progress. I think as the bureaucracy grows, it always makes coordination a little bit more challenging. So we're trying to work with that.
Well, I know that there should be interest on both sides there. I think that's great. There are a lot of questions to be asked, so I just want to just talk a tiny little bit. It was discussed already about the expedite regulations, and I know that you're going to work on collecting input that is essential, even though we're trying to move these things to make them better a little more quickly. The feedback from the people in operations are critical, and I know you're sensitive to that. What I wanted to talk about very quickly is the Human Services Development Fund, and I guess every county's response is a little different because mine happens to be very excited about it. They like the flexibility. There's a broad demographic diversity across this Commonwealth as far as needs being served countywide. Yes. Here's my thought on that, and I'm wondering where you're going with the element, two of them, flexibility with regard to operations within a county, whether it's use of service contractors or oversight of contractors, which is also essential, so that they have opportunities to really be flexible within the provision of services in the county. How are you handling that? Because that's the only pushback I'm hearing at all is this is great, but we still have some limitations. Let's use transportation as an example. Allow them the flexibility to create transportation pools or other sources of combining transportation to hold back costs but still be able to provide. Our biggest challenge is we want to be able to provide for the people who need it most. So can you talk to me about that part of that fund and the new structure in the county?
I think we share the same sentiment that we want to provide the services to those that need the most, and the block grant delivers the needed flexibility to the counties to be able to do that, because as you know now, their allocation is siloed through 6 separate funds. They can't move money around, and it's been a complaint of theirs. And we know that the reduction is a challenge, but as you just alluded to or just said, your county is excited about it. So we have heard from counties that most of the counties are excited about it. Some of them are not excited about the 20% reduction, but others have said that they certainly can handle it and work with it, and I think probably yours is one of them. The bottom line is that we want a system where when the state is not onerous on the counties. Right now, we ask them to do 101 things plus 25. I mean, we just keep going. We send them more bulletins, more direction, and after a while, they've complained and complained. They just can't even follow what we're asking them to do. So we want to adhere to safety and health and safety standards, but and give the counties performance measures so that they can start to really move money around, create money where it's needed, while still ensuring public safety. I mean, I can't really say too much more than that, simply because CCAP is working with our team, and we still don't have a definitive answer as to what it's going to look like. They are working very quickly, and probably within the next 30 to 45 days, they'll have something that we'll be able to show.
Thanks. I know I'm not telling you anything new, but communication is the cornerstone of success here. And I realize that we can't give out information that we aren't secure and confirmed in, yes. But I know what it's like on the county side, too. So.
Well, we have, just to address that, we have 2 things that are going on. One, we have a committee that's working with CCAP. We also have established in the department a county commissioner with staff work group that's working directly with me on all of their vexing and important issues. And they have a lot of important issues that are either on the periphery of the block grant or are addressed in the block grant. And we're working with them on a weekly basis or a bi-weekly basis. We either have a conference call or a physical meeting. We just had a meeting this week with them, and various commissioners are on that, and staff from around the state. So maybe if your county would like to be involved, we're establishing some work groups, one on children and youth, one on mental health, and the other on long-term care. So we have 3 committees we're working on, so that for the first time, we're now starting to work with the counties. This has never been done. It's always been a one-size-fits-all. The state is dictating. We don't believe in that, and we certainly don't want that relationship with Washington, and we don't want to do that to the counties.
Thank you. Very good answer. It is a little intimidating to them because it is all new, but I think the positive perspective on it is healthy for us. It's a good foundation. I'm going to stop now and save the rest for a second round. Thank you for accepting the monumental task.
Thank you, Representative.
Thank you, Representative.